How can I understand my stroke diagnostic results? Understanding your stroke diagnostic results can feel overwhelming, but breaking it down makes it easier. When you go to the hospital with symptoms like weakness, speech trouble, or numbness, doctors start with quick assessments. They often use tools like the FAST test, which checks for facial drooping, arm weakness, speech difficulties, and the time to call emergency services. They may also use the NIH Stroke Scale to measure how severe your stroke is. A higher score on the scale means more significant neurological problems, which helps your medical team decide how urgent your treatment needs to be. Next, imaging tests play a key role. The first test is usually a non-contrast computed tomography scan of the head. This quick scan helps doctors see if there's bleeding in the brain, which is crucial because bleeding strokes need different treatment than blockages. If the CT scan looks normal but symptoms persist, an MRI might be done later. MRI scans are more sensitive and can show smaller areas of brain damage. Sometimes, doctors order CT or MRI angiography to look at your blood vessels, helping identify blockages or abnormalities causing the stroke. Perfusion imaging can also be used to see which parts of your brain are still getting blood and which are at risk, guiding treatment options like clot removal procedures. Your imaging report might mention terms like infarct, which means brain tissue has been damaged due to lack of blood flow, or hemorrhage, indicating bleeding. Occlusion refers to a blocked artery. The aspects score, which ranges from 0 to 10, helps estimate how much brain damage has occurred. Higher scores mean less damage and a better outlook. Laboratory tests are also important. Blood tests check your blood sugar levels, as very high or low sugar can mimic stroke symptoms. Coagulation studies tell doctors how well your blood clots, which is vital if clot-busting drugs are considered. A complete blood count and cardiac tests like an electrocardiogram can reveal underlying heart issues or blood clot sources that might have caused the stroke. Putting it all together, your results help determine if your stroke was caused by a blockage or bleeding, how severe it is, and what treatments are safest and most effective. For example, if it's an ischemic stroke caused by a clot, treatments like clot-busting medications or mechanical clot removal might be options if you're within the right time window. The location and extent of brain injury seen on imaging also relate to your symptoms and recovery potential. Timing is critical because many treatments work best when started early, usually within a few hours of symptom onset. To truly understand your results, don't hesitate to ask your healthcare provider to explain what each finding means in simple language. Clarify what type of stroke you had, how severe it was, and what the next steps are for your care. This might include medications, rehabilitation, or lifestyle changes to prevent future strokes. Remember, every stroke is different, and recovery varies widely. Early treatment and ongoing support can make a big difference, but some challenges might remain. Always follow your doctor's advice and seek personalized guidance for your specific situation. Your results are a vital piece of the puzzle in managing your health and recovery, so understanding them helps you stay informed and engaged in your care.